television series. This evening, we delve deep into the deepest interior of rural Ghana, a place a lost traveler may describe as the middle of nowhere. Our roving team paid a visit to Kutebwem, on the Ghana-Togo border, a remote, isolated town in the Volta region, where telecom signals barely reach and most of the broken dirt roads lead to more broken dirt roads. At night, the roads are dark and treacherous. We went to Kutebwem to find out how people living in these isolated towns and villages access healthcare services. What is the quality of services there? How do pregnant mothers cope with emergencies? Which health professionals work there? What are their conditions of services, and what challenges do they face? Join us on the road to Kutebwem. This is one of the most picturesque parts of Ghana, and the forests are evergreen and mostly unperturbed. Our journey to Kutebwem turned eventful because the road infrastructure is bad and treacherous in many places. Driving with a tough four-wheel drive even had its challenges. At night, the road turned hauntingly quiet and unnerving. I imagined a pregnant woman being rushed in an emergency along this road and on a motorbike, which appears to be the only practical means of transport around here. In the morning, we discovered a giant pothole in the road. Imagine being a woman and traveling on a motorbike to a health center. If she's in labor, if she's having any kind of complications, will this woman on a motorbike actually get there? We continued our journey towards Kutebwem, located along the Ghana-Togo border in the Volta region. As my eyes scanned the beautiful forest green, the sign for a small health post came into view. We could not resist a quick visit. The health post is run by two dedicated workers, Madame Owusu, the midwife, and Mr. Amwa, who were both glad to see us.
It's not simple.
It's not simple.
All that I'm saying is not simple. We are managing.
We were keen to find out as much about this health post as possible. You have a doctor on staff here.
A doctor?
Is there a doctor here?
No doctor.
So who takes care of the patients who come?
The nurse. Yes.
We wanted to know how pregnant women get to the health post.
Those from the villages, because of transportation difficulties, the road, some are not coming.
Madame Owusu says her workload is too much for her.
This is my labor bed. If the pregnant women, if they lie on it, they complain bitterly because the bed is not straight. 2 delivery sets, cord scissors, episiotomy scissors, only one. This is a resuscitation tube and a rubber. I have only one. So if I have more cases, I have to refer to the hospital.
The work is too much for us. Sometimes I'll go to the village, I'll come back, labor case is waiting for me. I have to continue because there's nobody. I've been suffering. Even I had a cold now, but I have to come to the because nobody is there to help. I've not been going on leave. I'm overworking myself, but I'm doing it.
One issue truly gets Mr. Amwa's pulse racing. It is the refusal of some doctors to take up posts in rural places like this.
As for me, I like everywhere they send me, I'll do my work. Some don't like that. They want to be in the cities.
Because it's there that they get incentives.
So there's no incentives here, and you're saying there's incentives in the city?
Oh yes, that is why they all the time want to be there.
What kind of
they
incentive?
They know their own incentives they get.
What kind of incentive?
Well, I don't know the reason why when you are posted to a rural area, you feel like no, not going. It's not because of incentives which you feel you may not get there.
I don't know, you tell me.
That's what I'm saying. And that's what they have been saying. So I believe it's true. At the moment over here, you are there, whether you can work from morning to evening. As you are closing, then another pregnant woman will come. Maybe it's coming to deliver, you'll be on hand to the following day. Do you understand? You've called for other midwife, but they don't come. Why? They all the time want to be at the urban area. They know what they get there. They know if there's nothing I feel, they will come.
If you request, they said no midwives. But they are training them every year. They say no midwives.
So what's the solution? How do you think you can get people to come here?
They should train more people.
But there's so many training, but they're not coming here.
That's what I'm saying. They don't want to come. So they should find out and know the reason why they feel like not coming to the rural areas, so that they solve the problem. When they contact them, they will tell them the reason why, so that they find ways and means of solving it.
When you graduated, did you come here straight or you stayed in Hohoi before you came?
I stayed at Hokwe. I stayed at Jessica before coming here.
And why did you decide to come here?
I want to come here and save lives. Because I've learned the work to save life. So anywhere I can save life. I don't want my clients to die. I want everybody during the pregnancy and then after the pregnancy to be healthy with the child. So
you ask and continue asking. When you go to the district, you ask, they'll tell you there are no midwives. There are no midwives. So one midwife over there, what would she do? What power has she got? We send our niece over there. We need midwives. Oh, there are no midwives. What will you do? So we are still waiting. At least there should be two. At least two. At least two. But there are some cases whereby even some of us have to join you and then be helping. But if there are midwives, at least two, that's fine. But only one. And because of that, no way for her to go on leave.
The ambulance services in the area also gets his immediate attention.
Sometimes the car will be at Jessica before you call. So,
However, we are having two cars. Their numbers. The community found out those cars for us for emergency. So anytime I thought there's an emergency like that, she's that call upon me. I take the motorbike straight forward. If I don't get their number, straight forward to the station over
So
there.
you take the motorbike
Yeah,
Yes.
taking the motorbike straight to the town
to go get the car.
to get a car, if in case I'm not getting there. So anytime I thought I reach the station, any car at all I get, straight forward.
What help do they need here? Are the district health authorities sensitive to their plight? What about a blood bank? I'm sure you don't have a blood bank here.
No.
Is there one at Jessica?
Yeah, those one.
They do have a blood bank there.
Yeah. Or is it, I don't have it. The blood bank. I don't have it.
I don't know.
No. I think no.
They don't.
I think no.
So if somebody is to need a blood transfusion, where will they go?
You send the relatives.
You send the relatives
What we know, you have to bring a relative immediately
to the hospital.
to the hospital. Or if they are having any there, then I think this is what they do.
And if they have no relatives, then what?
Then it's over to them to, have anywhere they will get.
What? You mean from anybody who lives in the area, they would
Well,
just
I
ask?
don't know. What I know is they send relatives. Sometimes they will ask, bring a relative for the blood. If they are able to get any blood over there immediately for the person, they will tell you, bring somebody for
To
replacement.
replace.
The discussion got interesting and more meaningful as we progressed. It was clear that our impromptu visit had yielded a wonderful discovery. So, if you could ask for anything, no money is a concern. You can ask for anything to assist you here. What would you say is the biggest needs for maternal health?
If we have the ambulance, it will help me a lot. And then extra midwife to work with me for any emergency so that we can refer early without delaying.
An ambulance accommodation for some of the few staffs. And what again? What again do you think is needed?
The extra hand.
And the extra hand, that's what I'm saying, extra hand. Accommodation for the few nurses over there. As a midwife, up and down, 24 hours, paying her own rent. It's serious.
As we said goodbye, we felt truly proud that through us, the whole nation would hear about their plight and join them to find solutions to their challenges.
Good evening and welcome to today's discussion segment on the Maternal Health Channel. On my immediate left, I'm honored to have the District Director of Health, Dr. Samuel Abude. Dr. Abude, you're welcome.
Thank you.
On my immediate right, I have Elizabeth Osuche, a midwife, the only midwife at the Bodada Health Center. And next to her, I have Gershon Amwa, who is the enrolled superintendent nurse in charge of the center. Welcome to both of you.
Thank you.
Right. Maybe I'll ask Gershon, tell us a bit about the center.
That center seems to be a remote area about 3 kilometers to the district capital, Jessica.
Okay.
And it seems the problems we are having over there is very bad road networks, however.
Right.
And then referral difficulties in referring cases, especially maternal cases.
Mr. Amwa, let me ask you, I mean, when we say a health center, really, what are you equipped and designated to do?
Any case which is beyond us, we make sure we refer the case to the nearest hospital, which is the TC Hospital at Jessica.
So if you give us an example of what is outside your domain or what is beyond you, and also give us an understanding whether the people in the district are aware of these, should I say, restrictions on the function of the health center.
Some of the people are not aware of what is really happening. But we explain to them that your case you are having at the moment is beyond us, and therefore you have to go to the district hospital for proper care.
So I need some of those cases because I feel, for example, that if I rush to a facility, I'm not interested in who's supposed to do what. Wouldn't that create problems and delays, which we are worried about already?
Some can be serious malaria.
Complicated malaria.
And therefore we need not delay the case. So we have to allow the person go straight to the hospital.
Okay. So is it the understanding then that you deal with minor cases and anything that's complicated must be referred upward to the district?
Immediately.
Immediately. Right. And that's where you have challenges with transportation?
Yes, we have challenges. Sometimes a case which should be referred, we delay due to lack of transport.
Right. Let's get a full picture of what we mean when we say lack of transport. You don't have an ambulance. So what is the mode of transportation for these critical referrals?
What we normally do is we call upon those few taxi drivers in town to help us immediately to transport the case to the hospital.
I dare say on the ground and in practical terms, this will be a challenge, even though Mr. Amwa explains it as something that works well. Let me come to you, Auntie Elizabeth. You are the only midwife. I understand that there are 6 health centers and only 2 of them have midwives. Doesn't that place a load, a burden on your shoulders?
Really, it's a burden on me, but I've been trying hard. And because of all these problems, I have to create antenatal clinics in some of the villages to help them. So every month I've been going. Because of transportation difficulties, they do deliver in the village. If the condition is critical, before they rush the person to me in the clinic. And if I cannot help, then I refer the case immediately and follow up.
Okay. Now, let me ask again. You said you'd set up satellite antenatal clinics in the villages. How does this solve the problem? How does this help you and the community?
Because of transportation, really the road is not good at all for a pregnant woman to be on a motorbike. Some will be falling down, they will come and complain. So now that I'm attending to them over there, the attendance is increasing greatly.
Now, you are the only midwife at post.
Yes.
So if now you set up these satellite clinics, right, and you visit them in turn, doesn't that leave your center at Bodada exposed?
Really, the center is exposed because I'm alone. If I leave the center and then maybe a labor case, then the labor case have to go to Jessica.
That brings me promptly to you. How do you see the picture in the district?
The picture is not very good. As you rightly said, we have 6 health centers in the whole district. And out of these 6, only 2 health centers that are having midwives, a place and one other place called New Ayoma. They are doing their best, trying to organize this satellite antenatal clinics. Actually,
is that a policy or is it just her discretion?
It's not a policy as such, but to be able to get the pregnant women to attend clinics. Some of them once they feel fine during pregnancy, they don't care that they have to attend a clinic. So taking the services to closer to them will solve some of their complications that might arise suddenly.
How is it that you have 6 health centers and you have 2 midwives? Is it that there are no midwives or they are not being posted to your district?
You know, the lack of midwives is a big problem facing the whole country. And I will not say it is only in the Jaskan district. There was a time that most of them are going on pension and we're not replacing the adequately. So not that they are somewhere and we are not posting them. They are just not there.
You are an enrolled nurse superintendent and you are in charge of the facility. Exactly. Elizabeth is the midwife. Right. Who else do you have on the ground?
Now I'm having the 1 lab assistant.
Okay.
And then 3 community health nurses. Okay. 1 orderly.
Orderly.
Yes.
Right.
And that's all.
That's it.
Yes.
And how do you manage?
Anytime I thought she's not there, let's say he's gone to the village. Now the community health nurses interrupt by giving the how do you call it, routine drugs for those recording them and then giving them their routine drugs.
Okay.
But if there's any complication, then of course straight to the hospital, or the next day, if possible, they should come and meet the midwife himself.
Okay.
The
community health nurses cannot supervise a delivery.
They supervise. They have been doing
on their own without Auntie Elizabeth present.
No, without Auntie Elizabeth present, then it's not.
So
done.
Technically,
it's not
essentially,
done.
They can't do anything when she is gone.
They can't do it.
Right.
They can't do
it. So this makes your day a typically difficult day.
Very difficult. Sometimes when a person comes over, you could see that even the person can no more walk. And the midwife too is not there.
Right.
But we should do something. So it's there that I have to rush upon any of those taxi drivers to do the job for us.
Assuming you get the taxi driver, who pays for the taxi?
The patients themselves pay for. We don't pay from any of our pockets.
Right.
Yes.
It sounds very complicated and very precarious if we seek to save lives.
Yes, that's the situation over there. And as the midwife is saying, she is alone. And anytime that she plans, if it's on her itinerary, to visit any other community to conduct the antenatal care, then it means nobody is left behind. If any emergency comes, and it needs to be attended to immediately, then it means they have to refer that person to the district hospital. Can you imagine that even at the district capital, the hospital has no ambulance. The ambulance services also, we don't have one in Jaska town itself. So in the whole of Jaska, we don't have any ambulance services.
So even the point to which we are referring are, in quotes, emergencies. There are stark deficiencies.
There are deficiencies there also. Until 1.5 years ago, I have been the single doctor who has been there acting as a district director and then acting as the in charge of the hospital.
Medical officer in charge.
Yes. But fortunately, we were able to attract one doctor who is now at post and is helping
so you're actually doing
much.
Clinical and administrative duties?
Yes, I've been doing clinical and administration all these years until the new doctor has come.
So if Auntie Elizabeth has to go on leave or touch wood on retirement, what does a district director do?
Yes.
And does she actually go on leave?
She once in a while has to take leave as anybody else. And in particular at her station, which is about a 15-minute drive from the district hospital, it means all cases have to find their way and come to the district hospital for attention.
For a lot of us, especially on the Maternal Health Channel, it sounds like, and it's continuing to sound like, maybe the system is not doing its best for these unfortunate women who lose their lives. What would you say to that kind of position which says we should be doing better, we should be resourcing better to make sure that this is not the situation?
Yes, to be doing better, we need the resources to be available, the human resource, and then the technical resource, equipment, blood bank, and all the theater, everything should be set so that if the emergency should come, the doctor should be there, midwife should be available, and the other technical staff should be available to render the services as and when is needed. At times, you don't have these technical staffs, and you sometimes have to improvise. Somebody is not an anesthetist, but you have to, in a way, try to let somebody do something for you to be able to get on.
Auntie Elizabeth, you've been at Bodada for 7 years. What's keeping you there, and why is it difficult for you to attract some of your colleagues who are midwives?
I've been there for 7 years. And because of the good work I'm doing, that's why I'm still there. But the other colleagues, I don't know why they don't want to come and join me. Maybe they don't want the remote area. I don't know their reason.
The conditions?
The conditions, how I've been going to the bush and coming back. Maybe they don't like it.
Do you have accommodation?
I rented my own.
You rent, but you get an allowance for rent?
No.
No. Dr. Abude,
Yes.
each time I have to come back to you. These are serious challenges, and I guess as the district director, you are supposed to manage what you've got, and also put out a clear statement as to what you need. What would you say with regard to these personnel and resource challenges?
You know, she's saying she is the only midwife at that station for the past 7 years. And she rightly said that maybe other colleagues are not willing to come because of the conditions there.
Right.
But I wouldn't agree that the colleagues are there and are not willing to come over.
There's a clear shortage.
There's a clear shortage of midwives in the country, and for that matter, in the Volta region and in our district. So as I was saying, in 6 health centers, we have only 2 midwives, she and one other one. And I wouldn't say that we have more of them even at the hospital, and that they are refusing to go to the sub-district.
Okay.
At the hospital also, there are not more than 4. And you look at the whole hospital.
That's the Jasikan District Hospital.
The Jasikan District Hospital. So
Okay.
we cannot even cope with the numbers at the district hospital. And there, they have to work without going on off days. So some have to do continuous day in without any rest.
If I should ask, if you had a magic wand and you could change some important, critical things, Mr. Amma, what would you want to change at Bodada?
What I really want to be changed is those transportation difficulties.
Okay.
I need another midwife so that we can save life. And then ambulance for transporting our emergency cases.
Okay. That's your wish list. And the district director, what would you put on your wish list? I'm sure yours will be a long one.
How they've said, I already told you that in the whole district we don't have a single ambulance. So the district needs an ambulance. If it's for the ambulance service, fair enough. But the hospital itself also needs an ambulance.
Okay.
And then the staff. We are trying to do our best, and we want others also to join us. We want more midwives to be posted to our district. And currently, apart from myself, we only have one doctor at the hospital now. We need more doctors to be posted.
I'll pray for these wishes to come true, and that the good personnel that you have on the ground stay and are indeed rewarded for their good work. Viewers, you'll agree with me that our visit to the Bodada Health Center in the Jasikan district of the Volta region has been really educative and informative. Stark shortages of personnel, they don't have the resources, mobilizing blood, dealing with critical emergencies is a huge challenge. Indeed, we should congratulate the staff who are with us here for the job they are doing. But nevertheless, there are still gaping, yawning questions and gaps to be answered and filled. And that's the purpose of the Maternal Health Channel. Let me take this opportunity to thank our guests again for spending time with us. Critical time they should have been spending at the health post. Auntie Elizabeth, thank you very much. Gershon, thank you so much. And of course, the District Director of Health, Dr. Samuel Abude, we thank you for being with us on the Maternal Health Channel.